Hi, I'm Barry Strader, Communications Director with the Alberta College of Pharmacy, and today I am joined by Greg Eberhardt, ACP Registrar, and today we are talking about supervision in your pharmacy, including definitions of and the differences between direct supervision and indirect supervision. But Greg, before we get into all that, let's talk about the requirements for supervision and why that's so important for your pharmacy's safety and security.
Safe and effective pharmacy practice depends on the competence and effectiveness of regulated and unregulated pharmacy team members working within a system defined by policies and procedures that are consistently monitored to ensure that compliance occurs. Supervision is the means through which individuals authorized to perform regulated functions provide oversight of others who assist in performing the regulated function. Supervision is exercised in multiple ways by multiple team members depending on their registration status and their roles and responsibilities. Policies and procedures that do not include appropriate supervision or that do not include monitoring to ensure that supervision is occurring are high risk. Failure to provide appropriate supervision has and can result in public harm and risk to pharmacy team members.
All right, Greg, so who can provide supervision?
Pharmacy licensees are responsible for establishing policies and procedures in a pharmacy, including supervision requirements and procedures to ensure that they're consistently monitored for compliance. Supervision must only be carried out by a pharmacist or pharmacy technician in accordance with the Pharmacist and Pharmacy Technician's Profession Regulation, the Pharmacy and Drug Regulation, the standards for the operation of licensed pharmacies, and the policies and procedures of the pharmacy.
So what are the differences then between the requirements for direct supervision and indirect supervision?
Direct supervision requires that the supervisor must be authorized to perform the restricted activity being supervised, be present when the supervised individual is performing a restricted activity, and be able to observe and promptly intervene or stop the actions of the supervised individual. When indirect supervision is permitted, the supervisor must be readily available for consultation and, if necessary, for providing hands-on assistance to the supervised individual. Ensure the supervised individual complies with procedures and have procedures in place that comply with the standards and ensure the safety and integrity of the dispensing or compounding of drugs by the supervised individual. Any failure in quality, safety, or security is the responsibility of the supervising pharmacist or pharmacy technician.
Okay, Greg, so when is direct supervision required?
A clinical pharmacist or pharmacy technician may provide direct supervision over any individual performing a restricted activity that they are authorized to perform. A clinical pharmacist or a pharmacy technician must provide direct supervision over provisional pharmacy technicians completing the structured practical training program and all unregulated pharmacy team members, including pharmacy assistants. A clinical pharmacist must provide direct supervision over provisional pharmacists completing the structured practical training program. A clinical pharmacist must provide direct supervision over pharmacy students at all times. This includes direct supervision of any student or intern who has met the requirements to administer drugs by injection by a pharmacist who is authorized to administer injections.
So when is indirect supervision permitted?
A clinical pharmacist may provide indirect supervision of provisional pharmacists who have completed the structured practical training program, depending on their evaluation of the readiness of the candidate to practice under indirect supervision. A clinical pharmacist or a pharmacy technician may provide indirect supervision to a provisional pharmacy technician in accordance with structured practical training rules.
Okay, great. So Greg, what are the advantages of having a pharmacy technician on your pharmacy team?
The highest performing pharmacy teams include pharmacy technicians practicing to their full scope. Pharmacy technicians are regulated health professionals who are authorized under Section 21 of the Pharmacist and Pharmacy Technicians Regulation to perform the restricted activities of compounding, dispensing, and selling drugs. Pharmacy technicians are formally trained and evaluated at entry to practice. They can take personal responsibility for quality assurance and safe and effective practices related to these restricted activities. Due to their competence, pharmacy technicians do not require supervision like unregulated individuals such as pharmacy assistants, but can practice under the direction of a pharmacist. Pharmacy technicians who practice to full scope allow pharmacists to provide better care for their patients.
Great. And finally, Greg, do you have any tips for pharmacy teams in implementing these supervision requirements?
Sure. Know when to provide direct supervision and when indirect supervision is permitted. Clearly understand your pharmacy team. Know which team members are regulated and which are unregulated, and understand roles that each may take on. Ensure that unregulated individuals always work under direct supervision. Develop policies and procedures that optimize use of your team's knowledge and skills. Encourage pharmacy technicians to practice to full scope. Build the necessary supervision requirements within your policies and incorporate monitoring procedures to ensure that they are complied with. Ensure every patient has opportunity to engage with a pharmacist when presenting at your pharmacy. Patient assessment and education is part of the clinical process relating to dispensing and prescribing, and therefore, safe and effective pharmacy practice requires pharmacist engagement.
Great advice. Thank you very much, Greg, and thank you all for joining us. We'll see you next time.
Thank you, Barry.